Welcome to Optimal Anesthesia, Unlocking the Potential of Pharmacogenetics in Anesthesia, the podcast that takes you on a journey through the fascinating world of personalized medicine. Today, we're about to unlock the secrets of pharmacogenetics in anesthesia. Get ready for a deep dive into its history, and we'll shine a spotlight on crucial genetic variations that are changing the game in anesthesia care. Imagine if every time you took a medication, it was perfectly tailored to your unique genetic makeup. That's the promise of pharmacogenetics. It's all about understanding how your genes influence your body's response to drugs. This knowledge empowers doctors to create treatment plans that are like a precision-guided missile, hitting the mark while avoiding unwanted side effects.
Pharmacogenetics didn't appear overnight, it has an intriguing history. Back in the 1950s, sharp-eyed researchers noticed something curious. Some families seemed to have their very own way of reacting to certain medicines. It was like having a family secret for how drugs worked. This was the early hint that genetics might play a role in how our bodies respond to medications. But it wasn't until the 1990s, with the help of supersmart tools in molecular genetics, that scientists began to uncover the hidden genetic codes behind these differences. It was like discovering a treasure trove of genetic secrets. This discovery journey turned pharmacogenetics into a full-fledged field of study. Then, in the early 2000s, things got even more exciting. We started using a fancy term, pharmacogenomics. This means looking at your entire genetic playbook when it comes to drug responses. It's like reading the entire story, not just a chapter or two. Fast forward to today, and pharmacogenetics is like having a super advanced GPS for your body's response to medicines. It's taking us on a journey toward personalized medicine where your treatment plan is as unique as you are. So, the next time you take medicine, you'll know it's tailor-made just for you. We're delving into a genetic twist that influences something many of us have faced: pain management during surgery and the role of opioids. Imagine this: you're in the hospital for surgery, and the pain afterward is something you're concerned about. Well, that's where the magic of genetics comes in. You see, not everyone responds to pain medications the same way, and that's where the OPRM1 gene, our genetic star of the day, steps onto the stage. The OPRM1 gene is like the conductor of an orchestra, and its job is to make sure opioids like morphine hit the right notes in your body. But here's the twist: it can come in different versions, thanks to something called genetic variations. Now, let's get into the nitty-gritty. There's a specific variation of OPRM1, called the A118G-SNP, which is like a genetic switch that can turn up or down the sensitivity of your opioid receptors. These receptors are the locks that opioids like to open to help you feel better. If you have the G version of this SNP, it's like having a lock that's a bit rusty. Opioids might not fit as snugly, so you might need a bit more to get that pain relief you need. On the flip side, if you have the A version, it's like having a brand new lock. Opioids fit perfectly, and you might get strong pain relief from standard doses. So, you're probably wondering, what's the big deal? Well, it's a big deal because it helps doctors fine-tune your pain management plan. If they know which version of OPRM1 you have, they can tailor your treatment. For folks with the G version, they might opt for higher opioid doses to ensure pain control. But for those with the A version, standard doses can work wonders, and there's less risk of overdoing it. Plus, knowing your OPRM1 genetic profile can open doors to alternative pain management strategies. Things like non-opioid pain relievers, regional anesthesia techniques, or even a personalized opioid dosing plan. It's like having a pain relief menu customized just for you. So, there you have it, the OPRM1 gene and its role in the world of anesthesia. It's a genetic twist that can make your post-surgery experience more comfortable and tailored to your unique genetic composition. We all know that anesthesia is about ensuring patient comfort and safety during surgical procedures. An essential tool in achieving this is the use of neuromuscular blockers, NMBs. These magic potions induce temporary paralysis of muscles, making sure patients stay still during surgery. However, here's the twist: not all patients react the same way to these agents, and that's where genetics comes into play. Now, let's get into the nitty-gritty of genetics. At the heart of this genetic influence lies the AKE gene, which encodes the acetylcholinesterase enzyme. This enzyme is a real game changer. Its job is to put the brakes on neuromuscular transmission, effectively ending the muscle party. But, and this is a big but, genetic variations within the AKE gene can lead to differing levels of acetylcholinesterase activity. Some gene variants produce acetylcholinesterase that's a little sluggish in its job, like a slow-motion action hero. Now, here's where things get really interesting. Enter succinylcholine, a neuromuscular blocker commonly used in anesthesia. This superhero of a drug works by binding to acetylcholine receptors at the neuromuscular junction, essentially telling muscles to take a nap. But here's the twist: succinylcholine is like Cinderella at the ball. Its magic wears off, and that's thanks to acetylcholinesterase. It steps in to break down the succinylcholine, allowing muscles to wake up. But what if I told you that in some patients with genetic variants causing sluggish acetylcholinesterase, succinylcholine's magic doesn't wear off as quickly as it should? These patients may experience prolonged muscle relaxation. In essence, their muscles take an extended vacation, and this phenomenon is known as scoline apnea. Scoline apnea can be a challenge. It means patients might have difficulty coming off the ventilator after surgery, increasing the risk of breathing problems. So, what can anesthesiologists do to prevent this? First and foremost, they need to be gene detectives. They should be aware of AKE gene variants in their patients. Armed with this knowledge, they can adjust their strategies. Instead of succinylcholine, they might opt for different neuromuscular blockers or use personalized dosing plans to ensure a smoother wake-up call for those sluggish muscles. But that's not all. After surgery, it's all about playing it safe. Close post-operative monitoring is essential. Anesthesiologists need to make sure that patients' muscles are fully awake before they say goodbye to the ventilator. That's how we reduce the risk of scoline apnea and ensure a safer transition to the recovery phase. So, there you have it, a genetic twist in the world of anesthesia, where genes, succinylcholine, and scoline apnea converge. It's all part of the journey towards personalized medicine in the operating room. We all know that pain perception varies from person to person. Some people seem to handle pain like champions, while others may wince at the slightest discomfort. But did you know that our genes play a significant role in this pain puzzle? Meet the SCN9A gene, your genetic ticket to the world of pain. This gene holds the blueprint for NaV1.7, a sodium channel superhero found in peripheral nerves. NaV1.7's job is to transmit pain signals, and genetic variations in the SCN9A gene can shake things up in the pain department. Picture this: SCN9A gene variations can act like a dial on your pain sensitivity meter. For some folks, these variations might turn the dial up, cranking their pain sensitivity to the maximum. These individuals are like finely tuned pain detectors, feeling discomfort more intensely than others. Asterisk on the flip side, there are those whose SCN9A gene variations might turn the dial down. These lucky folks experience pain as if it's been dialed down a notch, sometimes even needing higher doses of local anesthetics, like lidocaine, to get that same numbing effect. But what does all of this mean for your trip to the dentist or that upcoming surgery? Well, here's the kicker: local anesthetics, like lidocaine, work their magic by blocking sodium channels in nerve fibers. These channels, including NaV1.7, are the highways for pain signals. Block them, and you block the pain. For our pain-sensitive friends with SCN9A variations cranked up to max, lidocaine might need to be cranked up too. Standard doses might not cut it. But for those with SCN9A variants turning the pain dial down, regular doses of lidocaine might do the trick. So, what's the clinical scoop? Well, understanding these SCN9A gene variations can be a game changer in the medical world. It's like having a secret code to each patient's pain perception. Picture this scenario: your doctor knows your SCN9A gene profile and customizes your pain management plan accordingly. If you're a pain superhero, they might adjust your lidocaine dose for maximum relief. If you're a pain champ with reduced sensitivity, they can stick with standard doses. The result? Enhanced patient comfort during procedures and smoother post-operative recoveries. It's personalized medicine in action. So, there you have it, folks, the SCN9A gene and its role in the world of pain and local anesthetics. It's like having your own genetic pain knob. As we conclude, it's clear that pharmacogenetics is a game changer in the field of anesthesia and pain management. The ability to decipher an individual's genetic code empowers healthcare providers to provide truly personalized care. It ensures that pain relief is optimized, side effects are minimized, and patient comfort is at the forefront of medical procedures. So, whether you're a healthcare professional or a curious patient, remember that your genes play a crucial role in how you respond to anesthesia and pain medications. The future of medicine is personalized, and pharmacogenetics is leading the way. Span class equals QL cursor, that wraps up today's episode. We hope you found this journey through the world of genetics and anesthesia both informative and fascinating. Stay tuned to Optimal Anesthesia for more exciting topics in the world of anesthesia. Until next time, take care. Span.